Yeah, so some of the successes we've seen with Qventus is really the holy grail of length of stay reduction. I think prior to Qventus, the challenges that Keck of USC faced was communication and data to inform that was the problem. And often what we found was day-to-day, the clinical team, being the MD provider, the nurse lead, and the case manager, were primarily focused on really the discharge of the day and maybe the next day. And what would tend to happen is some of the straightforward cases would go the day they were expected, maybe the next day, and the ones that weren't as straightforward would we see excess of 2-3 days more than when they were supposed to go. And then when we would go back retroactively to try to work on process improvement, the challenges we faced is we didn't have clean data. And you ended up having really finger pointing between different arms of the triad of the case manager, nurse lead, and physician. And it made it really difficult to make process improvement because everybody had their own version of why we were where we were at. And so what we've seen with Qventus integration is a 15% reduction of excess days, which has resulted in about a quarter, 25% increase in discharge volume. And so we can go back to our triad, no matter what their version of why or why not they want to work on length of stay, and say, hey, we reduced the length of stay on our patients, and then that's resulted in more patients being served at our medical center, which I think that everyone could agree is an important endeavor. So I think the main reason for going with Qventus is the software has this ability to not just track what we're trying to do in real time, but also then give really interesting dashboards for us to get insight on how to improve going forward. So a lot of other software might do one or the other. They'll either really, really good about tracking the daily throughput, and so we could kind of in real time make changes, or very retrospective, and we make process improvement later on in process improvement work. What Qventus presented to us was really software that in real time you can put in data entry and get real-time suggestions to improve, and then have these dashboards that we can look at in real time as well as retroactively. If I were to describe Qventus in one word, I'd probably say innovation. And I say that because it's easy for me to say things like change management, throughput, efficiency, but really it's innovation, because every time we tackle a new issue, Qventus has been able to offer something to handle that new issue. So innovation.